It's springtime here along the Gulf Coast, and with that comes the urge and often the need for a little spring cleaning. The same applies to our health. And today we have board-certified family medicine physician Dr. Jennifer Driscoll with Baptist Medical Group to give us information on how and why now is the perfect time to tend to our health. Dr. Driscoll, thank you for being here.
Oh, thank you, Jeff, and I want to thank the Council of Aging for inviting me.
Well, would love to have you. I'm glad you're here. Well, tell us a little bit about your experience as a family medical physician here before we get into really the spring cleaning aspect we're going to talk about.
Well, sure. I've been a physician for a little over 10 years. I just retired from the Navy and joined Baptist Medical Group, and I'm practicing in North Hill. As a family physician, I'm sort of a jack of all trades. I do pediatrics, women's health, and adult medicine. And more, this being a great retirement community, I do a lot of adult medicine and geriatrics.
Okay, well, great. Well, now let's get back into this spring cleaning, from a health standpoint. I'm sure probably that has a lot to do with medications. Would I be correct?
Absolutely. Matter of fact, one of the most important things you can do for spring cleaning your health is to make a list of all the medications that you're supposed to be taking. That list should include the name of the medication, the dose, the frequency, and which doctor has prescribed it. That's probably the easier part of spring cleaning. The harder part is you really should clean out your medicine cabinets. Empty your medicine cabinet, your bedside drawer, your purses, wherever you're storing medicines, and go through and throw out anything that's expired, anything that you're no longer taking, and that includes over-the-counters. And then you should get rid of them. And people often ask me, well, what am I supposed to do? How do I get rid of them? Right. Well, frequently ECUA does a prescription roundup, and you'll see that in the newspaper where you can just drop them off. Otherwise, most medications can safely be thrown in the trash, with the exception of narcotics. Narcotics you should flush down the toilet. And narcotics are things like Lortab, Percocet, things like that.
Okay. Well, not to jump ahead to the next season of the year, but we do have hurricane season. What about keeping a list of those medications handy for, say, whatever emergency reason? How should we keep that information?
Oh, that's a very important aspect. When you have that list, you should put it in your wallet or your purse. You should take it with you when you go to other doctors so they can update it. If you end up in the emergency room, the medical team will know what you're taking. So it's very important to keep that list updated and keep it where it's always going to be with you. Probably your wallet's the best place.
So why is this, knowing what you're taking and knowing that what you're taking has not expired, why is this so important to ensuring good health?
Well, that all goes to your safety. When you know what you're taking and when your doctors know what you're taking, it really reduces the chance of making a medication error. Your other doctors won't double prescribe something or prescribe something that interacts. As far as disposing of medications, I know we're all brought up to save things and not to waste, but this is one place where you really should throw out things. You don't want to take an expired medication or in the middle of the night accidentally reach for the wrong thing, or have your visiting grandchildren, maybe go through your purse and get something that they shouldn't be getting into. So really take the time to clean out your medicine cabinet and get rid of those expired medications.
What about if, say, a prescription is not expired, but for whatever reason you feel like you don't need it anymore, that type of thing? What kind of conversations should someone have with the doctor to say, I've been prescribed this, I'm not sure I still need it, can we reassess this? How do you handle those medications that we have but we just don't take?
That's a great point. Doctors always want you to be honest about what you're taking. We understand that what we prescribe sometimes doesn't work, it has side effects, but if you tell us you're taking it, we don't know to change things. As family physicians, we like to simplify. We like to go through your medicine list and say, do you really need this? Can we combine this? Can we get rid of this? So the first step is making that list, bringing it in, and then having an honest conversation with your physician.
What are some of the most common questions that you get from patients involving medication and what they should take or what should they keep? What are some questions from someone at home?
Well, I often have patients, when I change their prescriptions, say, should they keep the old prescription? Should they just keep it on the shelf in case 3 months from now we go back to it? And I tell them, no, just go ahead and get rid of that. Most likely we're not going to use it again if it didn't work the first time. And if we do need to use it again, then we'll get you a new prescription, up-to-date, fresh medication. But you really don't want to be keeping extra things around in your medicine cabinet.
Okay. Well, obviously, hopefully people don't need some of these medications because they're getting better and being healthier. So this might be a good time to think about some preventive screenings or things that would give us more information. What would you suggest as far as, is this a great time to add that to your spring list?
Absolutely. Besides organizing your medications, a preventive medicine checkup is probably one of the top things that should be on your spring checkup list, your cleaning list. When you see the doctor all the time for chronic conditions, sometimes preventive medicine things fall through the cracks. So go in and ask your physician about immunizations, for example. You know, we should have a pneumonia vaccine when we're over 65, the shingles vaccine, a tetanus booster every 10 years, and also the cancer screenings. A colonoscopy, not everybody's favorite, but your doctor can help you decide whether you need that to look for colon cancer, breast cancer screening, basic eye exam. Those are things that we tend to let fall through the cracks.
Well, especially when there's an urgent problem, the
Exactly.
more normal things, for lack of a better term.
So when you keep coming in for your pain, which is important, sometimes we don't get around to those preventative medicine things. So make that a priority this spring.
Well, you mentioned the shingles vaccine. I know that's very important for older adults, and a lot of people may not be getting that or recognizing that that is something they should be doing. What age guidelines or who would you suggest would be eligible?
Well, generally over 60 is the target population, and it reduces your chance of getting shingles by about 2/3. It can be a little bit of an expensive vaccine, but if you've ever had shingles, you know it's very, or if you know anybody who's had it, it can be very painful, and the pain can last for months. So if you're over 60, I recommend you talk to your physician and see if it's the right vaccine for you.
Okay. Well, so say one of our viewers at home is watching this and says, wow, I really need a healthy spring checkup here. What would you suggest that they do, and how should they go about implementing some of these suggestions that you've thrown out here today?
Well, first step, I say pick up the phone and call your family physician. And if you don't have a family physician or a primary care doctor, I do recommend that you look at establishing care with one. You may see specialists, but a family physician is sort of like the quarterback on the team. They make sure everything is working together well, nothing's falling through the cracks. My partner, Dr. Maguchi, and myself in North Hill, we're always welcoming patients, and we'd be glad to see you if you want to make an appointment. And there's also many fine primary care physicians here in the Pensacola area.
Okay, well, great. And thank you for explaining how we can get rid of those medicines, because I need to go home and clean out a little space myself.
I do want to add, this is not just prescription medicines. It's the cough syrups, the allergy medicines, the leftover narcotics from the dentist. And it's a great point to ask your physician, not just about those prescription medicines, but ask them what over-the-counters you should be using also.
Great. Perfect information. Thank you very much. We'll be right back with more coming of age and tips for spring cleaning a senior's home.